Hi, my name's Rena Sorensen. I'm a respiratory therapist. I have been for so long, I don't want to tell you how long I've been around. And I was given a list of questions to answer. So I don't exactly know who's out there, but I was given some questions to answer. So I've got this CAN presentation, but I'm an RT. So I mean, if you have questions, I can try and answer them as we go through the presentation. So one of the questions I was asked was about the environmental impact of inhalers. And so specifically, we're probably talking about the MDIs, right? And the aerosols and the thinning ozone layer and all that fun stuff. So before I jump into that, I just want to kind of make a distinction between the different types of inhalers that are out there. So we have the MDI, the meter dose inhaler, that kind of sprays out a liquid and it forces it out, and it has a propellant in it actually that was part of all those aerosols that were sort of outlawed in the 90s. The MDI aerosol actually got a bit of a hall pass for a few years there because they were deemed medically necessary. Like back in the 90s, we didn't have too many other inhalers other than these guys. So they've been around a long time and they've kind of snuck through, but they do, although modifications have been made, they're not obviously as safe as like a dry powder inhaler. So the bottom three puffers there or inhalers that we have, those are like the discus or the turbuhaler. They're dry powder inhalers and they're lovely. They're absolutely wonderful medications. You can get everything you need in almost either form, truth be told. But the dry powder inhalers, they don't use a propellant because you are the propellant. So if you've ever learned how to take a dry powder inhaler, you have to be able to take a deep, fairly quick, fast breath in. You got to use the force and you have to generate enough airflow that it picks up that powder that's inside the inhaler, picks it up and deposits it down deep into your lungs, which is where we need the medication to go. Whereas the MDI's got a little bit different technique in it, and it sprays it and it spritzes it and then you gently pull it in. So both are fantastic ways to take a medication. So what's the difference? Well, I can tell you that a couple of years ago, the Canadian Medical Association Journal did some research and they mapped it out. So meter dose inhalers, the ones that spray out the liquid or the vapor, I guess, they're responsible for very little, but they were able to establish that carbon footprint and that they account for 0.03% of the yearly global greenhouse gas emissions. So in the grand scheme of things, this is pretty small. And if you think about these and balance it in terms of the benefit that they provide for the clients that truly need that medication delivered via this specific route, it's a bit of a small price to pay. But I mean, as with any environmental debate, there's always someone who can probably debate the other side of it. Okay, so to put it in perspective, the carbon footprint of using a whole one of these is about the equivalent of a trip to Edmonton and back again, starting from Calgary or vice versa. Okay, so that's about the carbon imprint of this style of medication. In relation to the MDI or to the dry powder inhaler, so the MDI, the liquid one, has about 100 grams of carbon dioxide per spritz per inhalation, whereas the DPI, the dry powder inhaler at the bottom, the ones at the bottom, they will get about 20 grams of carbon dioxide per inhalation. And so it's not like the dry powder inhalers don't actually aerosolize anything. Nothing gets put into the air. The carbon footprint accounts for, the packaging and the pieces that go to the landfill and transporting it here. I don't know. I'm not an environmental expert, but there's more to a carbon footprint simply than what you might spray into the air. So they sort of account for all things, and this is how the math works out. So at face value, it is a more environmentally conscious decision to switch away from this towards the dry powder inhalers. And that's a perfectly acceptable decision. But before anyone makes a decision like that, let me talk about the medical or clinical reasons for why you might, I just want you to pause and think about it first. Okay. So one thing we need to think about, or put it all together and take a step back and take a bigger picture of things, is that the carbon footprint of a hospitalization is huge. So one hospital bed, and like you can think of a hospital bed that might have 12 or 20 patients that cycle through in a year, right? Patient gets discharged, we clean up the bed, another one gets put in. So that bed accounts for the carbon footprint in terms of keeping the lights on, all of the staff, all of the water, all of the electricity, all of the technology, the medications, all of the things that we do, is roughly the equivalent of about 5 Canadian households that run the washer, the dryer, the dishwasher, the TV, you know. So putting it in perspective, if a couple, you know, a few puffs on this every so often, might not be blue, might be a different color, whatever. But if a few puffs of this can keep you out of a hospital, I mean, it kind of tips the scales, doesn't it? So it's about the relative risk and how, you know, what's the likelihood that you might become hospitalized if you start mucking around with your medications. So everything that you might be offered in MDI form, you will be able to, if you work through it with your pharmacist and your physician and your respiratory therapist, whoever your clinical team is that supports you, you're going to be able to find an equivalent in a dry powder inhaler form. That part I'm not worried about. The medications, there's a poster behind you that's absolutely huge. The amount of medication, respiratory medications we have these days, we'll be able to set you up. That's not the issue. It's not a matter of not being able to access the medications. It's about being able to get the medications that you need into your lungs adequately to prevent a hospitalization. So it's about a balanced choice. So I have sort of 2 questions for you. How likely is a hospital admission for you, right? If you're a fairly controlled asthmatic, as severe as things might get, but you're on top of it and your triggers aren't something that you can't avoid, you know, the only thing that you can't control is like forest fires, and, you know, for the most part you're able to control your life, then hospitalization probably isn't that likely, and you can take the chance. But if you have something like COPD or pulmonary fibrosis or something a little bit more complicated, where a hospitalization, you might be at higher risk for a hospitalization, then you need to think carefully about making sure you make the inhaler choice where you know for certain that you can get this medication down into the lungs where you need it. So the second question that I think you need to think about as patients who you maybe want to switch away from this towards a more environmentally conscious choice, which I applaud. I think that's fantastic that you would want to make that choice. I just want to make sure you make the best choice for you. There's lots of things that you need to balance when deciding something. So the question you need to ask yourself is, can you dependably count on your body's ability to take in a deep, fast breath so that you can get your medications in? So asthma's got more challenges than like pulmonary fibrosis. Pulmonary fibrosis, there could be when things get really severe, maybe you can't trigger it and you can't pull it in fast enough. But for a short, hot minute, you could, you know, I mean, that's pretty fast, but you can go a little faster than that. You can probably get it in through your dry powder inhaler. That's fine. But if your lung capacity is so low and so compromised, and if you just go like that, all of that powder is going to sit on your vocal cords and the back of your tongue and the top of your neck. And this medication will get into your bloodstream, and all it'll do, you might get enough that it might cause a side effect like thrush or something, right? It's the reason why we rinse our mouth out with some of our medications. It's not going to get into your lungs. And this is where we need it to go. So you have to be honest with yourself about your capacity to generate enough force that you can get this medication in. Okay, so the MDI technique. So I'm probably speaking to the choir, but you always take the cap off, give it a shake, And Jamie, I do have these slides are referenced. I gave the slides to Jamie, and if there's a reference slide at the end, so you can go to the website where these resources are. So you got to give it a good shake. And we highly recommend a spacer, because if I push this out, it's kind of dark in here, you should see it just kind of all shoots out. And you can try, there's the 2-finger width, and you can try your best to get the medication in and try and time your inhalation and whatever. But trust me, it shoots it right out, and the vast majority of that medication is going to hit the back of your throat and stay there. I highly, highly recommend a spacer, because it will hold all of that medication. It's got a special coating on the inside of the spacer that will keep the medication airborne and kind of sitting there floating until you get a chance to breathe it in. So the spacer that I have, I don't know if you can see it, but you can't quite see right through it. There's this thing inside there sort of blocking it. And it's got this, yes.
You're actually still sharing the slides, so we can't see you.
Oh, well, I will stop. How do I stop a share? I'm so sorry.
Oh, so there's a
Stop
little
share.
button at
there
the,
it is.
yeah, there we go.
Thank you. I found it. Okay, sorry. Back. Now you can see it. Yeah, I've been showing you guys all this stuff. Okay, I'll go back. So this, if I just press a dry powder inhaler, I don't know if you can see that, but it shoots out to about here. And if I put my head in the middle of this, you know, it overshoots by quite a bit. That's how they're built. Okay, so you will get some medication into your lungs if you try and time it and carefully place it and all that fun stuff. You're going to lose most of your medication. A spacer is, trust me, the best way to go. Okay. And what I was trying to show you, I'll just show you again, is that if you look inside the spacer, there's a thing. Kind of turn around. You can't quite see me straight through the end there. There's what's in there is a valve right around here. And at the top is the exhalation port. So if I breathe in and out, you should, I don't know if you'll see it. You can see it moving. So that's a valve. And what it's doing is making sure that I don't exhale into this thing. Because when I put my medication in here, it holds it. You can, it's like it's holding all the little medications on this, on these, that's small enough so that you can take a breath in whenever you want and breathe it in. So the best way to take this is a nice, slow, deep breath in and hold at the top if you can, because these little particles like to move. But the beauty of a spacer is that you can breathe in and out. You can just do regular tidal breathing, because sometimes when you're really short of breath, that's all you can do. And if that's all that is available to you when the going gets tough and you try to get your medication out of a dry powder inhaler, you might not have enough force to get it in any farther than your neck or your vocal cords, right? So I do recommend a spacer, and I recommend a valved one. And I'm here to tell you, I have asthma. And I am an RT, so I know a lot of things, and I have zero medication. I control my asthma completely with environmental controls. I know what to stay away from. I know what not to bring into my house, and I know what to avoid. And for the most part, that works for me, but I can't avoid like smoke outside, and I can't avoid things like the flu. And I just recently got over the flu, and I don't take any medications, you guys. By the time I take them, they're all expired. I have to get a new prescription. But when I had the flu just last month, it's not that I couldn't breathe. It's that I couldn't take in any type of a breath without coughing. I had this hyperspastic cough. I couldn't talk. I definitely couldn't tell a joke. I couldn't laugh. Anything I did would send me into a coughing fit. And if you're prone to coughing fits like that, and it's just, you can't shut it down, you're not going to get your medication in. And any type of a deep breath is going to trigger that cough. It can be really difficult to get that under control. So if that's you, then you can take your medication this way and have just a nice, and I'm breathing in and out right through this thing. I don't have to worry about, I don't have to worry how big my breath is. I don't have to worry about going up to the very top and holding. I will say that going up to the very top and holding will get the most amount of medication into your bloodstream as possible. It is the absolute gold standard. But if you're in a pinch, and this is all you can do, then tidal breathing, just normal in and out calmly through this thing. Trust me, the goal is to get the medication down into the lungs. At the vocal cords, we're not doing much to help you. Okay, so there's one reason why an MDI might be a better choice for you. I did get a question about, there's a whole host of people out there that can never do an MDI until they get a little bit older, and they're about this size. So if you've got a little one and they need to take their breathing inhalers, their breathing medications, then there's no DPI, there's no gel pido inhaler that they're going to be able to take a big breath in and hold it and listen to mommy and do all the things. Maybe once they're 4 or 5 and they're used to it, but until then, that's not the case. So this is my bear with lungs on him, and I don't have the spacer that has a mask on it, but there is one. I think I have a picture. Oh, I'm not sharing my slides anymore. Anyways, pretend there's like a little mask that goes over this, and it just kind of fits over top of their nose and mouth. You kind of want to get the whole nose and mouth and squish it in. And I'm going to show you. Sorry, I just have to move this. This is my special technique. I worked in Emerge for a lot of years. So this is Ben, and he's really mad at me, and he can't breathe, and he's got to take his medications, and he doesn't want to sit still, and he's having none of it. So I'm going to take this arm, and I'm going to tuck it under my armpit, and I'm locking Ben in. And I got his other arm, and I'm holding it with my left hand. So both arms are neutralized, and his head is held in tight into my elbow. He can't do it. He can't escape. And if these legs are kicking, I get him and I put him in between my leg. I cross my leg over top of the other one. Ben is neutralized. He's not going anywhere. And if he could swear, he would. I get evil baby gibberish yelling at me. I worked in Emerge a long time. So this kid ain't moving. And my other hand is free. So I can shake it up. I can take my time. I can spray it in with one hand before I do it. And then I can put the mask over nose and mouth and put it on. And I just sit patiently and wait for Ben to help, because he's very mad at me, and he's going to scream and yell and take some nice big breaths, and he's going to get his medication in. And I know he'll get his medication in because I've got a spacer with a valve on it at the top. So he's mad as a hornet. And I say, I'm so sorry. I know. Just a minute, Ben. And then I wait and I shake it up, because I got to wait 30 seconds in between puffs. And then I can take it, put it right over, give it a shot, put it on, and he's mad at me, and there's tears, and we go through this till he's got his medication in. The more he howls, it's actually better, the more medication he's going to get in. Okay, so that's me. I'm a mean mom. My kids tell me I'm mean. I won't take them to Emerge unless the bleeding's arterial. I worked in Emerge for too long, so I don't go in for nothing. I do a lot at home, and that's how you can neutralize a toddler if you're really in a pickle, or you can wrap them in a towel and do all kinds of things. But I've seen these little squirts wriggle their way out of a towel without much effort. It's crazy how they can get out of it. So that's my hold. That's my technique. And you just have to make sure you go over the nose and mouth. Okay. And
thanks, Rena. I just had a question from
yes.
someone from our asthma support group. They have a 4-year-old with Down syndrome. They are just wondering what they could do to modify their spacer, because they're finding the spacer plus the inhaler just doesn't fit very well for their child's face structure. And they've tried, I believe, the yellow pediatric and blue pediatric spacers and haven't found anything that works. But what it's ended up doing is it'll take in the medication just sprays out, so they're not actually inhaling much.
Yeah. Is it the masks are too big? Because with the tiny little chin, is that what it is?
The mask is
Yeah.
too big. They've tried even like a infant mask with a spacer, and it's still not working.
It's not working. I'd have to do some digging. There were spacers once upon a time. I better be careful. I'm old. It's been a while since I looked into this, but they would call them OptiFlow or OptiChambers, I think. And it didn't have a mouth, like a specific shape. It was just a circle, just a plain circle that would come off as the mouthpiece. And that circle was the same size as a something that we use in Emerge called a bagger. Okay, so if we had to intubate someone and put a breathing tube in and all that fun stuff, the bagger has a tube that would fit right over the opta chamber. So the mask that I might use to bag a baby, I could put onto an opta chamber. And so if you can do that, then you have all of these different masks that you could look at, different kinds of masks that might seal over the face that we could look into. Does this person have access to an asthma education clinic anywhere close
No,
to
they,
like to
they live in
find?
a rural Alberta hamlet.
Hmm. Well, I'm pretty connected. If you wanna, if this person's comfortable and sharing their information with Jamie, who can share it with me, I can probably find a community ERT in your area, and we'll see what we
Okay.
can't do for you.
Yeah,
Because it
for
is
sure.
a
I
bit
see
tricky.
Ursula also made a note here. So I'll definitely look into that. Thank you both.
Yeah, I think that we'd have to find something special, but you need to have access to someone like me who understands the products and has some masks we can try, stuff like that. Okay. I think that's my spacer demonstration. I did the whole thing. Okay, so now I got to switch. One moment. So I switch back to sharing this screen. Okay, so this is the one with the mouthpiece, and you take a slow, deep breath in and hold if you can. The dry powder inhaler on the right, it all starts with the same thing. You either slide something or twist something, or somehow you're going to hear a click of some kind with a dry powder inhaler, because there's actually a little packet inside it, like a pack of gum almost. You know, you puncture the gum or a pill out of like a tinfoil lined sort of packet, and the pill pops out or the gum pops out. There's little minuscule little packets like that in these dry powder inhalers. And so when you twist, slide, or open whatever mechanism is on the dry powder inhaler, I've got the Ellipta on the screen right now, it's going to open that packet. So it's very important that you don't exhale into the device, because the packet's open, you're going to blow the dust everywhere, the powder everywhere, and you'll never see it, by the way. It's very, very small. So you always turn your face to the side and blow out away from your inhaler. Then you put it in your mouth and you take a great big deep breath in. You know, you are the propellant, so it's a little bit faster. It's not going to be a nice slow breath, but you take that deep breath in. And then with the dry powder inhalers, well, all the inhalers, we like to either rinse or gargle and spit after we use it. Okay. And this is the one with the, it's the same MDI one, but it's just with the mask over the nose and the mouth. So trying to find a mask that, and if you see, this one kind of looks more like the old spacers where you could interchange the mask. Just pop one mask on and try a different one. So we'll see what we can do for, is it Ursula, for the person who was asking the question. Okay. So yeah, so if you want more information, the Community Pediatric Asthma Service has some of the best, all of the images I was showing you about the different devices comes from the U of C ICANN website. It is at the top, I Can Control Asthma, and it's also referenced in this slide deck if you like it. But it's a wonderful website. And even if you don't have asthma, if you just want to know how to use a different device, they've got some of the best device teaching resources that I've seen. So, and they're based in Alberta. Okay, so any more questions about inhalers and device usage
Yeah, I
before I
just
switch
have
topics? Sorry.
one more question. I have a patient here who has COPD, also has pulmonary fibrosis. They are wondering if there is an inhaler on the market that would work well for all their symptoms, because right now they are on a different inhaler for each condition.
Yeah. Um, yeah, that's unfortunate. I hear you. There's a lot of puffers, and it's not appropriate for me to ask what meds you're on and which devices and all that in this venue. So I would say that a pharmacist is pretty available no matter where you live, right? Hamlet or not, everyone's got a pharmacist that they can access to talk to. And so we usually rely on our pharmacists to make sure that our medications aren't going to interact with each other and nullify, or some sort of a drug reaction might happen. They're constantly screening their med lists for that, but they may not be thinking about optimizing or sort of minimizing the amount of devices that you're on in order to get the medication that you need into your body. So I would recommend following up with your pharmacist to see if there's, because if I can leave you for a second. Oh, I'm not sharing my screen, so never mind. Well, there's a poster that I'm looking at that has every respiratory medication that there is. The most medications you'd ever get in one puffer is 3. And that's fairly new. Generally speaking, they call it, there's dual therapy and there's triple therapy. So are a few puffers that exist, but they're mostly specific to COPD. But yeah, talk to a pharmacist and see if there's anything you can't do there. I'll just tell you that sometimes you have to jump a couple of hoops when it comes to funding. So like Blue Cross or whatever the fund, however you might get your medications funded, you might not be allowed to access a triple therapy puffer, for example, one that's got 3 different medications in it. If that one was appropriate for you, your Blue Cross or your health service provider might not fund that until you've been on 10 puffers, and then you go down to 5 puffers, and then you go down to 3. Like sometimes there's some hoops that you have to jump through, and your doctor has to prove that you didn't do well, or we sort of failed to stabilize on the medications when you're on all the puffers all separately before they'll fund like a dual or a triple therapy device, just so you know.
Okay. Did anyone on the call have any questions about inhaler use at all? Feel free to unmute yourself and let us know. Otherwise, we'll have Rena move on to the next topic.
Okay, well, I can hit the ground running, stop me at any time. So the next question that I was asked was about the AQHI. So the Air Quality Health Index. I don't know who's on the call and where everyone's coming from, but a few years ago when I worked at the Lung Association, I was there about 10 years back, had a great time. The AQHI app was a brand new thing, and we were prepping and marketing it everywhere. We tried to get everyone to get that app on their phone, and they did. And then if you try to go and use it, you'll realize that it's gone. I mean, it's not gone, but it's not going to work for you. So the Air Quality Health Index is, it's on a scale. The scale actually goes higher than 10, but for the most part, we only really pay attention to the numbers 1 to 10. So the idea is that the outside air quality, and the AQHI is available in lots of jurisdictions. So you can go in and find your city. If your hamlet's not on there, you can probably find the closest city or small town. So you can they got a pretty good coverage of the grid of Alberta to check on the air quality. And so we're probably most familiar with checking this when it's forest fire season. And then we go out, and if you've got activities planned outside, like you're a golfer, or you were going to go for a long walk outside today, or you were going to garden or whatever, any activity that you plan to do outside, if you work with a respiratory therapist like me, we always counsel our patients who have lung disease to pay attention to the air quality. And if it's like 4 or higher, you get into that yellow sort of red zone, maybe you're going to change your plans for today, and you're not going to go outside. You're going to take that walk inside on the treadmill instead, or trade around your activities, because being outside might make you sicker. So that's the Air Quality Health Index. There. And so it doesn't have its own app now. It's now been sort of absorbed by the WeatherCan app. So it's the Government of Alberta app. It's a great app. And you try and find someone who has a smartphone who doesn't routinely check the weather with their app. Most of the phones probably have a widget, which means the phone came with a thing on it that kind of looks and functions like an app. It just sort of came with the phone. And that's your weather app. Most people sort of just default to that, but I would For anyone who has respiratory issues, complaints, I would recommend that they use the WeatherCan app as their weather app. And so you can get it just at the store, because if you try to open the AQHI app, it'll give you a notice that app was retired back in 2022. So once you download the app, it's like any other app. And when you open it, this is what you'll see. And the AQHI is not immediately available to you. And I'll admit that it's right there. So no problem. Just one thing you need to know. So when you open the app, you just have to look for that little down arrow in the middle. Just say, I'd like to know information about today, please. That's what that arrow kind of indicates. So you click on that, and then you're going to, the drop down menu is going to expand, and that's where your air quality is. Okay, so I'm going to stop sharing. And assume you can see me now. So I'm going on my phone. And I'm opening, oops, oh, let's cancel it. Now I'm skipping stuff. Okay, so I'm going to open my WeatherCan app. And as you can see, I only have a little bit going on. So I click on, see if I can do this. There, I got that drop down menu. Okay. It's pretty small. I know I showed you on the thing before. So I'll take my word for it. All I'm going to do is click on the air quality health index, because on the app, it's probably telling me that the air quality is quite low. It's blue, it's 2. So if I just click on that air quality button, that 2, it gives me an expanded look at the air quality today. It gives me a little bit more information, gives me the color, gives me the predicted, what the air quality is expected to do in the coming hours. So there's sort of a hidden little air quality pocket in the web, in that kind of WebCan app. And that is where your air quality stuff is happening today. So I don't think I made a slide for this, but I will maybe mention, because I'm chatting with a bunch of folks who are dealing with medications and respiratory stuff. There is a way to check barometric pressure, but it's really, really tucked away and it's kind of a pain. But I just want to acknowledge that there are changes in air that have nothing to do with the air quality. So a barometric pressure change usually occurs, it doesn't have to mean a big shift in temperature, although it is associated with, if that big 10-degree swing or more that we've had in temperature. For some people who have lung issues, that can be a trigger. I don't know if you've ever been triggered or starting to have symptoms and you don't understand because there's no smoke and the AQHI is fine and you didn't pet a cat today and whatever, all the things that normally make you sick, you did everything right, you avoided it all, and here you are having symptoms and you don't have a cold or the flu and you're wondering what's going on. I would counsel you to just maybe think about what has the weather been doing. So a barometric pressure change can happen when there's a pretty good change in temperature, or it can just mean a change in the weather. So meaning changing from warm to dry and it started to rain, or it wasn't windy and now all of a sudden it is windy. That's a barometric pressure change for sure. So it's not going to impact all of you, but I just wanted to throw it out there because if you are sensitive to those types of things, it might be in your interest to kind of check out what the barometric pressure is doing on the WeatherCan
Just for like
app.
clarification, could that
Yes.
be something similar to, say, going from a place that's relatively dry, like Alberta, to say BC, where it's much more like humid, and coming back and noticing a change in symptoms? I had a question about that and how to manage the so-called adjustment period between the changes.
Well, well, that could just be flat out humidity alone. Like it's very, very dry here in Alberta. And your lungs, I don't know if you realize this, but the air, your nose, your upper airway, everything is inside there. It's all wet. It's surrounded by mucus and there's little hairs and all. It's doing this job so that by the time the air hits about here, this is your carina. By the time the air that you breathe in gets there, it needs to be 100% humidified and warmed up to 37 degrees Celsius, which is body temperature. That is the job of your nose and your upper airway. And we live in one of the toughest climates for that to succeed. So we get dry nose, we get nosebleeds for no reason, like in the winter at all. I'm I notice this, we get dry throat, you have to drink more water. It's very dry here, and we actually, your lungs don't like it. They like moist, warm air, at least from the Carina perspective. That's what it's supposed to be. So a humidity change, I would say that that's just humidity alone. I mean, barometric pressure might have been involved, but you can definitely feel the impact of a humidity change. So there are things you can do to manage the that transition. So if you've come back from, you know, Barbados and you felt fabulous, and it's not just your lungs, by the way, your hair grows more and your nails are stronger and your skin feels better, and there's lots of reasons why a more humid climate is helpful. And you come back here and everything drives up and is becomes sensitive and angry, including your lungs. They're a little bit ticked off. You can humidify inside your home, maybe not the entire home, but you can actually buy little handheld humidifiers. I've got a friend who is very impacted by humidity, and so I travel with her sometimes. And when we share a room, she's got a little humidifier. It's about this big. She just puts a bottle of water, like a regular one that you would buy, flips it up top, and humidifies the room for the night because she is so sensitive to the dryness. That's what she needs to do. If you're in the middle of suffering through it, because one of the probably the bigger impact of dry humidity for respiratory folks is on your secretions and mucus. I don't know how many of you cough up mucus or struggle with coughing it up, but the drier it is, the thicker that mucus will be. And that's just flat out logic. That's if you've got a lot of mucus to try and deal with, you can humidify it from the inside, and that you can drink more water. You can watch your fluid intake and make sure you're getting in enough, you know, an appropriate amount of fluid. I know some of us have fluid balance and water pills and kidneys and whatever. We got other things we have to watch with the fluid, but definitely that internal humidification, make sure you're getting enough water and that you're drinking actual water. You're not just drinking coffee and red wine or something. You have other sources of honest to goodness water in your diet.
Awesome. So I have one other question here, kind of an interesting one. When I am in an airplane, I find my inhaler doesn't work as well, even with a spacer. I travel a lot for work. Why is my inhaler just not working properly on an airplane? That's an interesting question.
I'm going to have to go on a plane and test it. The pressure is different on a plane. Like there is a lower air pressure. That's why everybody's ears pop, right? When you go up on them, everybody notice your ears popping. That is the ambient pressure around you changing. So the air is thinner up there, less oxygen, less air, period. And so when you are on a flight, they have to pressurize the cabin. Otherwise, our ears would do more than pop. We need a certain amount of pressure for us to breathe properly. So they'll pressurize the inside of the cabin, but they are not going to pressurize it to, like, you know, 600 whatever, to the normal barometric pressure we're used to. It's slightly lower. That's why your ears pop. So I'm wondering if the MDI has trouble dispensing. I would have to look that one up. If you really struggle with that, then that's one scenario where you might want to look into a dry powder inhaler. And that's what you use on your flights. It's probably something to do with the propellant and the mechanism and the fact that the pressure is different.
Okay.
The only other thing I might recommend in that scenario is to prime it. Okay, so the pressure, like inside your MDI, is this canister. It's gotten accustomed to what the barometric pressure is right now. I don't know if you notice this, but if you don't take your puffer for a while, the first puff is like nothing, like it's a little bleh. And then the second puff. So when I first walk up to my canister, and I haven't used it in 2 years because I control my asthma in other ways. I give it 4 good puffs, like open up, open up, open up. And it's almost like you're priming it. And now that I've opened that valve enough times, it knows what the barometric pressure is. It's accounted for it. So my next puff should be sort of prepped and ready to go. So that's the only other thing I can think of, is to prime a couple times and then take your real dose on the plane, just on the plane.
Looks like the follow-up here is that might be the issue because I do not prime my inhaler. Okay.
Yeah.
Mystery
And you don't
solved.
have to prime it. Like you only do that when you first open it up brand new, you
Mhm.
prime it. So maybe on a plane, you can try priming it. And if that doesn't work, switch to DPI. But I wonder if that's not it, just give it an extra puff or two.
You'd also have like a follow-up question just regarding the humidifier that you mentioned, where it's just powered by essentially a bottle of water. Do you know like the name of that or what type of inhaler that is or humidifier that
I'll
is?
text my friend right now as we speak. I'm sure
If you
it's just
find
off
out,
Amazon. Yeah,
I
it's
can let
not.
people know afterwards, but yeah.
Okay, yeah, I can follow up with you. It's not powered by water. It's a plug-in little unit. I just thought it was really cute because, this is her humidifier. She just opened up, cracked a bottle of water, plunked it on, and then it just starts spitting out humidity. It was like so slick for a little tiny unit in a hotel room. So I will text my friend and get back to you on that.
Okay, perfect. So I think that's all the questions we have for now. So I will let you continue with your presentation. Thank you.
I think I'm just about done. I'm pretty sure, but I can share my screen one last time. See how far I got. Okay, yeah. Look at that. I got to the end. So I'll just show you at the end of my presentation, I did include some hyperlinks to where I got all this information in case folks are interested. We can do that. Oh, I'm not even sharing. I didn't even press the button. Sorry, I laughed because the next slide I went to said, thank you. Are there any questions?
Hi, Clinton. Do you have a question?
Pain is a lot of things going on this past couple days.
Linda, hi, did you have a question? Oh, I guess not.
That's okay. I leave my headset on too. So, okay. Well, that's all I prepared. I just kind of tried
Sorry,
to
it
make
took me that long to figure out how to unmute.
Oh,
Nope, no
there you
worries.
go. Okay.
Oh no, I have to turn off. I was just curious about your friend's humidifier as well. It sounded really interesting.
Okay.
So we'll
Yeah.
have to check that out.
So I
Otherwise,
assume,
yeah, it's great so far.
okay. And I assume, Jamie, you have a way to get this information out to everyone.
For sure. So it looks like I
okay.
have one last minute question.
Sure.
I hate in my inhaler. Fair enough. You mentioned ways to manage your symptoms that don't involve medication. I don't want to go against my doctor's advice, so I will still use my inhaler. But how can I reduce my risk or need to use my inhaler often enough? How can I limit my exposure risk, my excessive symptoms, things like that?
Sure. And if you were my client, I'd have you into clinic several times. We'd have lots of conversations and meetings about this. So the first step is to identify what your triggers are. You have to understand what the problem is. So forest fire, smoke, there's some big ones that are easy. There are some that are very difficult to figure out what they are. Is it something at work? Are you allergic to the laundry detergent perfume? Is it in your house somewhere? It can actually be really tricky to figure out what your triggers are. And sometimes I would use things like a symptom diary. How are you feeling today? And what did you do? Where were you? What were you exposed to? Was today a laundry day? We go through all these symptom diaries to get to the bottom of what your triggers are. And once you've identified them, then you can build strategies around how you can limit your exposure to them. So if you're allergic to perfumes, then you can get every bit of scented product that is in your house and get rid of it. And there's changes you can do to there's things that you can do that are within your control. And then there's things that you can't control, like you can't control what scented products other people might wear around you. So you might choose to wear an N95 mask because while that protects other people, it also protects you. So believe it or not, it actually has a decent impact if it's fitted properly for you not inhaling airborne scents. So there's little tips and tricks for how you can protect yourself or avoid things completely. Like if what your trigger is at work, and I realize we all need to work or we need a financial security, but you're balancing that with your health. And so I have had clients in the end, what they needed to do was seek a different role, line of occupation right? Because occupational asthma was just, it was harming them, and it was going to be permanent damage. And so, and it's nobody's fault. It's not like anything was wrong with the workplace. They just happened to start becoming allergic to things that were there. So get a really good understanding of what your triggers are, and maybe you need help identifying them, because I recognize that can be tricky. Then understand the fluctuations and patterns of it. So if it's pollen, then there's absolutely a season to that. And I have people who are terribly, terribly allergic to pollen, but they're not sick the rest of the year. So I teach them how to only use their puffer for 2 months of the year, because we'd look up what the ragweed pollen season was, or the poplar fuzz, or whatever the thing is that they know they're allergic to. There's a way, I mean, you might need a little help and some Google searching in that, but you can figure out what the common pollen season is in Alberta for whatever it is. And I would teach them to take their the preventative medication, like this is a reliever or it's an emergency, the blue one. But if you have some of the warmer colors, the reds, the purples, take that puffer at whatever dose every day for 4 weeks before your season starts, and continue taking it throughout the season. And then when you know the season ends, you can wean yourself off your meds. And this is how I was able to get clients on medication just part of the time. And it really rests on how well you know your body, what your triggers are, and what kind of patterns you can expect to the triggers. So if wildfire season is just a pattern, and it seems to be a heck of a pattern in Alberta here, I got to tell you, then you might consider starting to take your puffer mid-June and taking it through until the end of, October or something. So take it for half the year. So with my clients, my goal was always to get them on the minimum amount of medication possible. So you'd always go heavy on that environmental control. Yeah, sorry,
Okay,
that's
perfect.
long-winded. Does that answer the
No,
question?
it
It was
does,
like
thanks.
hours and hours of work with someone like me, but we pick at it till we get to the bottom of it.
All right, so it looks like I have one more question. I use a inhaler for pulmonary fibrosis. I find that I tend to swallow some of the medication, even with my spacer. It tends to give me a cough, irritated throat, and I'm prone to getting yeast infections in my mouth. How can I limit the risk of that?
So for sure you need to gargle after every single time you take a dose. So, and if gargling's difficult, then drink some water, because your stomach's got hydrochloric acid in it. You go ahead and swallow it. It's safer down there than it is to hang out in your throat, where it's going to give you that painful yeast infection. So really, really rinsing and gargling your mouth good. There are things called tongue scrapers. They're in with the toothbrushes, and they look like a bit of a torture tool. And in fact, I think they kind of are. But you can get to the back and scrape your tongue after use. And you're just trying to flush things out as best you can. But you're not going to be able to scrape at the very back. So you have to do the gargling.
Thank you everyone for joining us. And thanks again for your patience as we worked out the tech gremlins, as it were.
I'm just happy there was people here. Yay. They didn't all leave because we were late. So that's good. Okay. Well, thanks everyone. Have a wonderful day and enjoy this fantastic heat wave that we're happening now after all that.
Thank you, Rena.
All right. Thanks
Bye.
everyone. Have a good night.